Good morning, everybody.
Good morning.
I want to thank everybody for joining us this morning. I want to acknowledge a long list of people, so please be patient. Commissioners Bill Lowry and Alma Anaya, who are chair and vice chair of our Health Committee at the Cook County Board of Commissioners. Dr. Eric Makaitis, who's CEO of Cook County Health. Dr. Tom Nutter, Behavioral Health Officer for Cook County Health. Dr. Inga Burnett Ziegler, Chief Behavioral Health Officer for the state of Illinois and a former member of our Health and Hospital Board. Dr. Kiran Joshi, Chief Operating Officer for Cook County Department of Behavioral Health. That's not right.
Public health.
Public Health, yes, I'm sorry. Dr. Kathy Calderon, Director of Behavioral Health Program Operations, Chicago Department of Public Health. Bianca Campos, CEO of Community Behavioral Healthcare Association of Illinois. Rachel Ingram Sims, Director of Behavioral Health, Access Community Health Network. I think I got everybody. Yes. Thank you, Dr. Nutter. All right. Throughout the month of May, I've been part of a variety of events that have highlighted the work organizations are doing to support mental health in Cook County. And our efforts must always stretch beyond any single awareness month. They must be sustained, inclusive, and designed in partnership with those who are most impacted. Mental health care should not depend on where you live, how much you earn, or whether you know the right person to call. It should be woven into the fabric of our public systems. Healing should be visible, accessible, and treated as the necessity that it is. As we recognize Mental Health Awareness Month, I urge all of us, elected officials, community partners, and residents, to stay engaged, to listen, and to lead with compassion. Mental health is public health. And Cook County is committed to meeting this moment with the urgency, equity, and empathy that it demands. The diversity of voices being represented by these organizations is important. The behavioral health needs in Cook County are great, and having representation across the spectrum is critical to ensure that no one is left behind. The timing is critical. Our county is facing a behavioral health crisis, one that touches every demographic. And unfortunately, this comes at the same time when the federal government is cutting health care funding, the extent to which is to be determined, and eviscerating government agencies and health services. Cook County refuses to stand idly by. We're leading by example, continuing to invest in our behavioral health ecosystem, and bringing together partnerships to improve the services available to all of our residents. I'm grateful to the Cook County Health Office of Behavioral Health for their leadership in bringing together hundreds of partners to find ways to collaborate and meet the needs of residents of our county. We're investing in coordinating and growing the region's behavioral health network because it will increase access to care and health equity, and because we believe this is simply the right thing to do for our residents. The plan reflects our values in Cook County. Again, mental health is health. That care should be equitable, and it should support every area of the county. Thank you. Now, I'm going to ask every person to introduce the person who will follow them to the podium. Dr. Eric Makaitis, CEO of Cook County Health.
Okay. Thank you, Madam President. Good morning, everyone.
Good morning.
I'm very excited to be here today on this very important day for the Cook County Health Office of Behavioral Health. Thank you to President Preckwinkle, to the Cook County Board of Commissioners, represented here today by Commissioner Bill Lowry, who's also our Vice Chair of the CCH Board, and Commissioner Alma Anaya, as well as our Cook County Health Board of Directors for their support of this important initiative. I'd also like to share my gratitude with the many partners who've joined us today, Dr. Burnett Ziegler, Dr. Calderon, Avik, Blanca, and Rachel. Your input and engagement have been critical to our efforts. And I would specifically like to take a minute to recognize the incredible work being done by the team from the Office of Behavioral Health. The office was established by Cook County Health in 2023, and since then, they've been tirelessly working in pursuit of improving behavioral health in Cook County. They work closely with Dr. Joshi and our team at Cook County Department of Public Health and others to align our system's efforts to holistically expand access to care. In the last year, we've hosted a behavioral health summit, a workforce symposium, compiled a regional behavioral health needs assessment, and a workforce report. We've also issued $44 million in grants to community-based mental health programs. This is an incredible amount of work in a very short time, and just the kind of positive change that needs to happen to improve health outcomes. But change doesn't happen in a vacuum. It requires buy-in and support from others, and that's just what we've created. Now, thanks to the collaboration of our partners representing the full spectrum of clinicians, government entities, community leaders, and people with lived experience, we proudly release our regional strategic plan. This plan underscores what many of us already know: mental health is health, and it must be treated just like physical health. Our livelihoods, our families, and our communities are all impacted by our emotional, psychological, and social well-being. Too many people forgo care because it's too difficult to get to, too expensive, or too stigmatized. Through this strategic plan, we want to brightly illuminate the front door to mental health care for all residents of Cook County. This is about more than Cook County Health. This is about building and coordinating a regional network of mental health care services that ensures no one gets left behind. The county is large, so we've developed a strategic plan that can guide providers and decision makers in implementing strategies at the hyper-local level to ensure that residents can access care they need close to home. This will promote equity and strengthen the behavioral health system for everyone. Thank you again, and it is now my pleasure to welcome Commissioner Bill Lowry to the podium.
Thank you, Dr. Makaitis. Good morning. I am Bill Lowry. I serve as Cook County Commissioner of the 3rd District. I also serve as Chair of the Cook County Health and Hospitals Committee and Vice Chair of the Cook County Health Board of Directors. Today is only possible because of the leadership of President Tony Preckwinkle, because of my colleagues on the Cook County Board of Commissioners, because of the leadership of Drs. Eric Makaitis and Thomas Nutter, because of the entire CCH team, and because of the CCH Board of Directors, and today is possible because of over 300 community partners. And today is important. Today is important because each of us deserves healthcare equity, as healthcare, be it traditional or behavioral, is a right shared by us all, not a privilege preserved for the few. Today is important because so many of us are suffering from post-traumatic stress disorder and other psychosis, and we don't even know it. Today is important because many of us know that we need behavioral health care, but we have no idea where to go to receive that care, especially after the city of Chicago closed 6 mental health care facilities in 2012, especially after 80,000 Illinoisans lost access to health care coverage during the 2018 budget impasse in Springfield during the Rauner years, and especially when we know that 49% of the individuals being detained at the Cook County Jail have been determined to have a mental health concern. It is essential that all of us in government work closely with the community as we find ways to resource mental and behavioral health care in all the communities of Cook County, as treatment breeds violence prevention, it breeds safety, and it breeds healthy living. It has been written that mental health is not just the absence of mental illness, it's not just the absence of pain, it's actually emotional, physical, and social well-being. CCH gets this, and that is why in February of 2024, CCH conducted a behavioral health summit where governmental, community, and private entities met with a singular goal to identify strategies and partnerships as we work to develop the county-wide behavioral health strategic plan, which we are celebrating today. That is why, following this historic summit, Cook County resourced mental and behavioral health care through the county's first impact fund, where 53 community organizations received over $44 million in resources to support preventative behavioral health care, treatment, and support services. And that is why earlier this year, Cook County launched a behavioral health workforce fund, which resourced the hiring of almost 31,000 behavioral health experts to satisfy the needs of the over 5 million residents of Cook County. And that is why earlier this year, CCH opened both a behavioral health stabilization unit at Providence Hospital and the Bronzeville Health Center, where the provision of acute and long-term behavioral health care is now available for residents who live in communities known historically as healthcare deserts. And that is why today we gather to celebrate the Cook County Regional Behavioral Health Strategic Plan, which will focus on 5 priority areas: systems alignment, workforce development, behavioral health services for children, youth, and families, access to treatment, support, and recovery services, and crisis system enhancement. To the residents of Cook County, know that we need you, know that we appreciate you, and know that we are here to partner with you as together we embrace the vision of the Regional Behavioral Health Strategic Plan for Cook County, which envisions a county where behavioral health care is prioritized as an essential component of overall well-being and where support is integrated and available to everyone, regardless of background, circumstances, or zip code. Thank you. It is now my pleasure to bring up my colleague and my dear friend, Vice Chair of the Cook County Health and Hospitals Committee, Omar Naya.
Good morning, everyone.
Good morning.
Good morning.
It is, I keep joking that I keep running into these wonderful people as we're celebrating each time, I feel. And I think today we celebrate a lot, especially because it's been, like it was mentioned earlier, just maybe about a year and a half where a lot of this intentionality was really put into place. So again, my name is Alma Naya. I'm Cook County Commissioner of the 7th District. I represent the southwest side of the city of Chicago, communities like Little Village, Pilsen, Bryant Park, and many other Latino, and I have a biggest concentration of immigrants. And as the Vice Chair of the Health and Hospitals Committee, I am honored to stand here alongside great partners, both in Cook County Health and Cook County Department of Public Health, and also just our community partners, which are extremely important as we launch the Regional Behavioral Health Strategic Plan for Cook County. Of course, I want to just thank all of the partners, Dr. Nutter, Madam President. We have Dr. Makaitis and many others in the room that continue to really be so focused on how do we really address this. Because we have done a lot, we have seen a lot, but the reality is that nothing really is accomplished without every partner and every stakeholder in the room and every stakeholder being intentional about moving in the right direction. I remember first hearing about the strategic plan during the Cook County Behavioral Health Summit back in 2024. And at the summit, we convened hundreds of community members, providers, family members to really talk about and collaborate in creating a mental health system that works for everybody, regardless of their background, their income, what language they speak, or what zip code they live in. Today, I am proud to see how far we have come. Again, we have been very intentional about providing mental health resources to everybody while being realistic about the challenges. This is extremely important because we know that things don't happen by themselves. They don't happen in the second largest county without really putting in a lot of effort. They don't happen without everybody really seeing what the end goal is and what we want to accomplish. And they don't happen without being realistic about the cutbacks that have happened, about the fact that Cook County is stepping up in an unprecedented way. And they don't happen without all of the different pieces that have been highlighted by the previous speakers. They don't happen without us partnering up and giving funds to the organizations. They don't happen without leadership really wanting this to be a priority. And that's why we're celebrating here today. And it is a plan. It is something that we're going to have to work very hard to accomplish. But you see how many people are here committed to this vision, committed to really helping create a seamless access point. And we have to be realistic that we continue to be that safety net, not only in healthcare, but now we're being that safety net in mental health. And that is a beautiful thing to celebrate today. I'm very also excited about the different priorities that have been highlighted. As Chair of Labor, I am very grateful to see that this plan also strengthens about our healthcare workforce and also tapping into educational partners and creating a pipeline that is not only diverse, but that is representative of the people that we serve. This is obviously something that we need to address because we can't do it. We can have all of the funding there, but if we do not have this workforce, it doesn't happen. So although there may be, a few challenges that we need to tap into and address, I'm confident that this strategic plan will serve as a guiding light to help us make the best decisions and elevate Cook County's position as a leader in mental health access. I look forward to working closely together with the different offices as we implement this plan through 2027. And again, I want to just congratulate Cook County Health and the Office of Behavioral Health for their work in breaking down those silos and ensuring that we do this work in an equitable manner. I will make brief remarks in Spanish. Buenos días, me llamo Alma Naya, soy comisionada del 7º Distrito del Condado de Cook, represento el suroeste de la ciudad de Chicago. Como vicepresidenta del Comité de Salud y Hospitales, me siento orgullosa de estar aquí junto con Cook County Health, celebrando el lanzamiento del plan regional de salud mental para el condado. Gracias especialmente a personas como Dr. Makaitis, la presidenta Tony Preckwinkle, Dr. Nutter, y a muchas personas de la Oficina de Salud Mental, cuyo trabajo y dedicación hicieron este plan una realidad hoy día. Recuerdo haber escuchado por primera vez sobre este plan el año pasado, cuando hicimos una cumbre de salud mental en el condado de Cook. En esta reunión reunimos a muchos miembros de la comunidad, creo que casi 300 miembros de la comunidad, familiares y muchas personas que son impactadas por estas situaciones. El goal o la meta de esa vez fue tener una colaboración y hablar sobre qué se tiene que hacer aquí localmente en el condado para tener un poco más de apoyo y acceso a salud mental. Hoy me siento muy orgullosa en ver que hemos logrado este plan y sabemos que tenemos que ser muy intencionales para tener recursos de salud mental a todas las personas. Y no importa igual las cosas que ellos tengan como barreras en su vida, si es lenguaje, si es quizás que no pueden acudir a este edificio físicamente, pero ahorita estamos trabajando en cómo se puede hacer, cómo se puede lograr esto. Y el condado sabemos que es un lugar donde muchas personas vienen y acuden a nosotros para tener acceso a salud y ahora van a poder tener aún más recursos y más acceso a salud mental. Agradezco a todas las personas aquí del condado que se han dedicado para poder hacer este plan, no nomás un plan que en realidad, ¿verdad?, físico, pero un plan donde todas las personas que están aquí hoy día van a trabajar para tener ese logro y alcanzar esa meta. Muchas gracias. Now I'd like to welcome Dr. Tom Nutter, Chief Behavioral Health Officer for Cook County Health.
Thank you and good morning.
Good morning.
On behalf of the Cook County Health Office of Behavioral Health, I must begin with some thank yous. First, thank you, President Preckwinkle. Without her vision, initiative, and leadership, none of this would be possible. Thank you to the Cook County Board of Commissioners, in particular to the Chair and Vice Chair of the Health and Hospitals Committee, Commissioners Lowry and Anaya, both of whom you've heard from already. To CCH's Board of Directors, and to CCH's CEO, Eric Makaitis, for his leadership and support. Thank you to our colleagues at the Kennedy Forum for their assistance in this project. On a personal note, I want to say thank you to our entire team at the Office of Behavioral Health. You are absolutely amazing. Special thanks to Jennifer Brothers, who is quite simply a force of nature, as many of you know. Thank you to our partners on our intergovernmental work group that was formed to ensure that the plan would align to the actions of all other government entities. Particularly thanks to the state, represented today by Dr. Burnett Ziegler, to the Cook County Department of Public Health, represented today by Dr. Joshi, and to the Chicago Department of Public Health, represented today by Dr. Calderon. Most importantly, thank you to the hundreds of local leaders, clinicians, and those with lived expertise who have contributed to this plan through their insights and feedback gathered at the summit last year, through the community needs assessment, through the workforce assessment, which is a joint venture with CCDPH, through the initial round of regional behavioral health collaborative meetings, from other feedback sessions, and myriad conversations over the last year and a half. The Regional Behavioral Health Strategic Plan for Cook County has not merely been a paper exercise. This has been a labor of love. The result of a thorough and thoughtful, sometimes even a bit exhausting set of processes. But I am proud to say that for the first time, we have a blueprint not just for CCH, but for all organizations in Cook County. A blueprint we believe will improve behavioral health and behavioral health care throughout the county. Throughout the past year and a half, we believe this work to be important and an important step forward. Recent and proposed federal actions over the past 4 months now mean that the work is absolutely critical for our systems of behavioral health care. In the current climate, we believe even more strongly in the necessity of all of us utilizing a single plan, modifying that plan as circumstances change, and working together. We will withstand the difficulties in front of us and bring about significant improvements in the behavioral health of those we are privileged to serve. So what's in the plan? The plan emphasizes growing our workforce and doing so in a way that reflects geographically and culturally the communities we serve. It emphasizes prevention and early intervention efforts, particularly for our children, youth, and families, who now face rates of behavioral health conditions at far higher rates than did previous generations. It emphasizes improvement in coordination of access, particularly all-important front door access to our systems of care. And it emphasizes enhancing and better aligning our crisis systems. Lastly, to ensure effective implementation throughout all regions of the county in concert, the plan emphasizes intergovernmental collaboration, strategic investment, tracking of progress on a centralized dashboard, and local actions orchestrated through 11 regional behavioral health collaboratives. The next round of these meetings literally begins later this morning, actually in just a few short minutes from now. Because a plan, no matter how thoughtfully written or collaboratively crafted, is only as good as its implementation. So while we are excited about the release of the strategic plan today, we are much more excited about getting these tasks accomplished together. Thank you. And with that, it is my honor and privilege to introduce the State Chief Behavioral Health Officer, Dr. Burnett Ziegler.
Good morning.
Good morning.
I am Dr. Burnett Ziegler, Chief Behavioral Health Officer for the state of Illinois. It is my pleasure to stand before you today in support of the Regional Behavioral Health Strategic Plan for Cook County. I'd like to recognize and congratulate Madam President, Cook County Health CEO, Dr. Makaitis, Cook County Chief Behavioral Health Officer, Dr. Nutter, Cook County Board of Commissioners, Cook County Health Board of Directors, and of course, the stakeholders who have contributed to the vision articulated in this plan. It is especially timely that we celebrate the vision stated in the plan to foster a healthier and more resilient county where all residents have equitable access to timely, comprehensive, compassionate, and high-quality behavioral health services as we come to the end of Mental Health Awareness Month. Mental Health Awareness Month is an opportunity for us to recognize the importance of mental health and well-being, to educate the public, reduce stigma, and promote support of those affected by mental health conditions, which is exactly what this plan does. To be sure, we are in the midst of incredibly challenging times. Recent reports indicate that the mental health of Americans has been declining, and most Americans feel that we are in a mental health crisis. More people now are struggling with stress, depression, and anxiety than they were before the pandemic, and those numbers continue to rise. Social and economic stressors have exacerbated trauma and traumatic stress that were already prevalent, particularly in minoritized and under-resourced communities. Our youth are also suffering. Rates of suicide among Black, Asian, Hispanic, and LGBTQ+ youth are rising, and so there is much work to be done. I can assure you that our governor and I, as the Chief Behavioral Health Officer, share your vision for mental and behavioral health wellness, and we are committed to being a strong partner and using our collective resources to execute the priorities outlined in the plan: system alignment, workforce development, behavioral health services for children, youth, and families, access to treatment support and recovery, and crisis system enhancement. Together, we can improve access to high-quality, evidence-based, culturally relevant behavioral health services in service of holistic wellness of our community. Many successes have already come from our collaborative efforts like the 988 Crisis Support Line, Beacon Behavioral Health Referral Portal, and standing up 6 CCBHCs in Cook County. We are in a pivotal moment in behavioral health. Though we face many challenges, there is also much opportunity, which is demonstrated by more conversations focused on the importance of mental health, more resources being allocated to mental health in our communities, and more efforts being taken to reduce the stigma related to mental health. We know that there is much more work to be done, and we at the state are delighted to partner in that work. Now it is my pleasure to introduce to the podium Dr. Karan Joshi.
Pardon me. Thank you so much, Dr. Burnett Ziegler. I just want to start by saying I'm Kiran Joshi. I'm the Chief Operating Officer for the Cook County Department of Public Health. Public health does not happen in isolation. We do our best work in partnership, and as such, I'm so thankful to have the support of such excellent and wonderful and progressive elected officials, including President Preckwinkle, Commissioner Lowry, Commissioner Naya, and many, many others, as well as the phenomenal peers, colleagues from sister agencies from the state and community-based organizations from the region. It's clear that mental health has become a top priority for public health departments nationwide. As was just mentioned, we face a significant crisis with rising rates of mental illness and suicide. Nationally, 1 in 5 adults have been diagnosed with a depressive disorder. More than half, over 28 million people, do not receive treatment. Among youth, 1 in 3 high school students report poor mental health most of the time. And in 2023, over 50,000 Americans died by suicide. This is the highest annual number ever recorded. That crisis is very real here on the ground in Cook County. According to data from the Cook County Department of Public Health, 1 in 3 suburban high school students report feeling depressed. 15% have seriously considered attempting suicide. And the youngest suicide attempt locally in recent years was by a 9-year-old. So if we could pause for a moment and reflect on the pain and life circumstances that a 9-year-old must have felt to consider ending their life, it becomes very, very clear why urgent action is needed. And yet we also know that child would have truly struggled to access the services they may have needed because the behavioral health workforce is stretched so incredibly thin. Cook County, as per the workforce report led by the Office of Behavioral Health and our agency, will need nearly 30,000 more behavioral health professionals by 2028. This is a 50% increase to meet demand. So once again, these challenges highlight the urgent need for comprehensive mental health supports and interventions, and dare I say, a plan to get us there. This is why I'm so, again, incredibly thankful to my colleagues at the CCH Office of Behavioral Health for developing the Regional Behavioral Health Strategic Plan. This plan will help us get there. Thank you. Now I'm going to turn it over to my colleague, Dr. Kathy Calderon, Director of Behavioral Health Programs and Operations at the Chicago Department of Public Health. Thanks.
Hello, good morning.
Good morning.
Thank you so much to our President Preckwinkle and our Cook County Behavioral Health Leadership and everyone who stands here. I am Kathy Calderon. I, she, her pronouns. I'm the Director of Behavioral Health Program Operations at the Chicago Department of Public Health. I'm here representing our amazing leadership at CDPH, our Commissioner, Dr. Ige, our Interim Deputy and Medical Director, Dr. Hua, who are working tirelessly to address all of the behavioral health challenges that Chicagoans and all of our residents in Illinois face. Thank you so much. You know, speaking to the need right now for strong leadership, we really need to be able to have the nuanced understanding of the challenges that we face. And I'm really appreciative of the behavioral health team at Cook County for taking such an intentional approach to developing this strategic plan. Every step of the way, they got community input, and we were working hand in hand with them, with the city, to really be able to drive what makes the most sense for a comprehensive plan. I know as leaders, we may all face a time where we don't have a roadmap, and we really need to figure out what to do off the cuff, and it's really great to have a roadmap in place so that we can really fit in all of the stuff that we're doing in a way that's very effective. Right now, more than ever, we need to be succinct with our resources. We need to be smart and really collaborative, and I really appreciate the spirit of collaboration that has gone through this process. At CDPH, we are a utility player for you all. We provide key services through our city mental health centers, providing outpatient therapy and psychiatry services. We also have our crisis assistance response and engagement team responding to 911 behavioral health crisis calls. We provide life-saving harm reduction supplies through our vending machines, through our Now program, which provides medication on the spot. And we also have a number of other programs across behavioral health, and I won't even mention, or I'll mention our violence prevention portfolio, but we can talk about that another day. But we are so grateful to have this partnership and to really have an action plan and clear steps forward for how we intervene and continue to support everyone on every level to address, to help improve well-being across the board. So thank you so much for your partnership, and we're excited to get to work. And I'm very happy to introduce Avik Das, the Executive Director of Cook County Justice Advisory Council. Thank you.
Thank you.
Good morning, everyone.
Good morning.
So I'm Avik Das, Executive Director of the Cook County Justice Advisory Council, the JAC. And we work to support the President and the Cook County Board of Commissioners on the hard work of being at the intersection of public safety and public health, recognizing that we center the person and not the crime, and we want to make sure that where there are doors and need for mental health services, that we're able to provide the kind of support at the community level to support people who are most proximate to being lost to gun violence, to being lost to the system of carceral contact, be it through law enforcement, courts, prisons, and jails. The JAC has been so happy to be alongside our leadership at the county government, alongside the leadership of Cook County Health and Chicago of Department of Public Health, to be able to look at how we can ensure that there is no wrong door to access behavioral health services, and that we humanize and not criminalize mental health need, where we find ourselves addressing crises in emergency rooms or prisons versus in consistent quality access to healthcare, specifically in communities most ravaged by experiences of trauma and gun violence. And so I end with the conversation around gun violence, recognizing that we're on the eve of Gun Violence Awareness Month from Mental Health Awareness Month. And we want to make sure that we recognize that we stand in support of the state, the city, and the county as a Government Alliance for Safe Communities, GASC, to be able to align our violence prevention investments with access to quality public health resources. And we're grateful to all the hands that put together the Behavioral Health Strategic Plan to be able to make sure that we center the person to have access to that quality care and reduce reliance on prosecution and criminalization of mental health. Thank you. Now I'm proceeding to welcome Blanca Campos, CEO, Community Behavioral Healthcare Association of Illinois. Hi, Blanca. All right, thank you.
Good morning, everyone.
Good morning.
My name is Blanca Campos. I am the CEO at the Community Behavioral Healthcare Association. We represent community-based mental health and substance use providers throughout the state of Illinois. Today marks a powerful step forward for the people of Cook County. The release of the Regional Behavioral Health Strategic Plan is more than just a document. It is a shared vision built through collaboration, persistence, and purpose. Over the past year and a half, we have been proud to walk shoulder to shoulder with community leaders, healthcare providers, policymakers, and advocates in shaping this plan. Our role was clear: to elevate the voices of those on the front lines and advocate for solutions that will truly make a difference. From the start, we championed two priorities: workforce development and crisis care. Because if we don't have the trained people in real-time support systems in place, we can't meet the need. At the state level, our association helped spearhead the creation of the Illinois Behavioral Health Workforce Center to develop strategies to recruit, train, and retain a diverse and qualified behavioral health workforce. Alongside our partners, we've also secured significant state funding for the behavioral health system, resulting in expanded access to care for those in need. Cook County's strategic plan captures this momentum. It's bold, it's grounded, and actionable. Most importantly, it sends a clear message to every provider, every family, and every person struggling in silence that change isn't just possible, it's already underway. But we're not done, not even close. With the proposed federal funding cuts threatening access to essential mental health and substance use services, we're especially grateful that Cook County remains committed to long-term strategic planning to better meet the behavioral health needs of its residents. Again, today, I proudly stand with all of you to highlight what this visionary plan represents and the meaningful impact it promises to deliver for our communities. I'm going to say a few words in Spanish as well. Buenos días, mi nombre es Blanca Campos, soy la directora ejecutiva de Community Behavioral Healthcare Association. Mi organización representa agencias de salud mental por todo el estado de Illinois. Hoy damos un paso muy importante para la población del condado de Cook. La presentación del Plan Estratégico Regional de Salud Mental no es solo un documento, es una visión compartida, construida a través de la colaboración y la perseverancia y un claro propósito. Durante el último año y medio, me he sentido orgullosa de caminar codo a codo con todos los líderes comunitarios, proveedores de salud, funcionarios electos para dar forma a este plan. Nuestro propósito estaba claro, dar voz a quienes están en primera línea y luchar por medidas que realmente marquen la diferencia en nuestra comunidad. Desde el principio destacamos dos prioridades principales: el desarrollo de la fuerza laboral y brindar apoyo a personas en crisis de salud mental. Porque si no contamos con personas capacitadas ni con sistemas de apoyo en tiempo real, no podremos satisfacer las necesidades de nuestra comunidad. A nivel estatal, hemos pasado propuestas de ley enfocadas en entrenar a la próxima generación de profesionales de salud mental y hemos obtenido inversiones económicas para ampliar el sistema de salud mental en el estado de Illinois. Y eso no solo son cifras en un papel, son más personas recibiendo la ayuda que necesitan cuando la necesitan. El nuevo plan estratégico del condado de Cook refleja ese impulso. Es ambicioso, realista y ejecutable, pero sobre todo envía un mensaje claro a cada persona, a cada familia, a cada proveedor que sufre en silencio, que el cambio no solo es posible, que ya está en marcha. En estos momentos, cuando el gobierno federal ha planteado la posibilidad de recortar fondos para los servicios de salud mental, estamos especialmente agradecidos con el condado de Cook y que este plan siga en marcha porque representa una visión audaz y los resultados aportarán al bienestar y la salud de nuestras comunidades. Muchas gracias. I now welcome to the podium Rachel Ingram Sims, Director of Behavioral Health at Access Community Health Network. Thank you.
Good morning.
Good morning.
My name is Rachel Ingram Sims. I am the Director of Behavioral Health at Access Community Health Network. I want to echo the sentiments of thanks to Cook County Health and the Office of Behavioral Health for investing in the people of Cook County. The Regional Strategic Plan helps to highlight the needs of behavioral health services and treatment for substance use disorder in our county, while also addressing the behavioral health workforce shortage. As the largest federally qualified health center in Illinois, Access is committed to being the healthcare home of choice, partnering with patients and communities across 34 health centers to improve overall health outcomes. Often, the federally qualified health center is the first interaction patients have with behavioral health and/or treatment for substance use disorder. Access's integrated approach focuses on the whole person. Our integrated care teams include primary care providers, psychiatry, behavioral health consultants, benefit specialists, community health workers, and more, who work collaboratively to deliver comprehensive care. By bringing these services together under one roof, Access truly integrates both primary and behavioral health services while helping to reduce the stigma often associated with behavioral health and substance use treatment by making it a natural, prioritized part of the healthcare experience. Access relies on our partnerships with community behavioral health organizations when we need to refer patients for additional services, linkage to higher level of care, and other community resources. Through partnerships with Cook County Health and the newly established regional behavioral health collaboratives, federally qualified health centers, and community behavioral health organizations are able to develop strong partnerships and referral resources to meet the needs of our patients in the communities they live. These partnerships and resources are vital to the improved physical and mental health outcomes of our patients in Cook County. Thank you. President Preckwinkle.
Thank you. Pictures.